Now, I've focused on a statewide approach where possible. Today, we're seeing facts on the ground and differing circumstances around the state support flexibility and a localized approach. Now, I want to be clear. We recommend that all Arizonans wear a face mask whenever you cannot socially distance, at the grocery store, at the pharmacy, at the bank, when you're on mass transits. We are going to change and update guidance so that local governments can implement mask and face covering policies and determine enforcement. Border counties are dealing with unique issues. This allows local leaders to tailor policies. In Arizona, we have our situation that is unique on our southern border. We have large metropolitan areas. We have rural areas and sparsely populated areas along with our urban areas. This will allow us to tailor guidance to address the spread with local, informed by local information. Now, in April, the CDC issued guidance recommending face masks as a voluntary public measure in public settings where social distancing is difficult to maintain. In April, Dr. Christ and I have shared this recommendation. In Arizona, my operations team has supplied 75,000 cloth face coverings to public employees, and I want to say thank you to the partnership with Brooklyn Bedding and Fabric in Tempe, FAB, RIC. Last week, we've seen studies supported by real data that speaks to the effectiveness of these face masks. Every Arizonan should wear a face mask. This is an issue of personal responsibility, and we're asking Arizonans to make responsible decisions to protect the most vulnerable in our communities. Arizona businesses also need to do their part. As we've reopened, there's been good actors. And I've said several times there's been outliers. By and large, Arizona businesses have been terrific. But there have been more than an outlier here and there. There have been some bad actors. I've chosen to focus on the good actors, trying to promote responsible decisions and good business management. But we need to address the folks that are not in line. So the Department of Health Services is updating its guidance. It will strengthen measures that will protect employees, customers, and patrons of these establishments. And if they don't, there will be enforcement, and they will be held accountable. We know most businesses are performing responsibly, and again, I thank you. I think you've done an incredible job. The requirements today will mirror the guidance provided to businesses upon reopening. For those that are operating responsibly, there won't be any change. It's going to be encouraging social distancing, 6 feet of distance between you and other customers, and limits on capacity when there's the option for a large congregation. If you're to look at this plan of action, we're going to continue to boost testing, including rapid results testing. Again, thank you to Dr. Michael Crow and Arizona State University. We're going to amplify contact tracing in partnership with the counties, deploying the National Guard with additional dollars for counties around the state. We're also going to have increased awareness of distancing and face covering guidelines. There will be a public service campaign around it, supported with dollars, updated guidance from health services. We're going to empower local officials to provide additional requirements necessary for their geography, and this gives us the ability to target hotspots. We'll continue to focus on long-term care, and that will be ongoing, a $10 million additional investment in PPE and face masks, and enhanced guidance for establishments to limit congregations. This guidance will be issued by health services. We will give establishments the opportunity to be educated on what is proper guidance, but serious changes are needed to be made, and there will be enforcement around those changes. So I encourage all business owners, leaders, and entrepreneurs to review that guidance with great interest.